guest columnist Tara Britton is the Director of Public Policy and Advocacy at the Center for Community Solutions, a nonprofit, nonpartisan think tank in Cleveland. Her main areas of policy research and analysis are healthcare and reform, mental health and addiction, HIV/AIDS. Ohio works first in the budget and legislative processes at the state and federal levels. Tara Britton, Director of Public Policy and Advocacy at the Center for Community Solutions. Photo courtesy of the Center for Community Solutions. If you know the history of the mental health system, you can quickly envision how we ended up in a situation where we commonly criminalize behavioral health disorders, where too many people with mental illness or substance use disorders are behind bars and too many local jails are providing behavioral health services. It's time to take a holistic approach to this issue and move away from criminalizing behavioral health disorders, and instead treat them the same as other diseases of the body, by providing adequate treatments and supports. This issue has been highlighted recently due to the opioid crisis. Approaches to address this epidemic have spanned the spheres of public health, healthcare, law enforcement, social services and criminal justice. When Community Solutions examines the criminal justice system's approach to dealing with the crisis, we get a closer look at how we reached this point in the first place. There was a massive shift of individuals living with mental illness and/or substance use disorders from facilities to other outpatient community treatment options. The process, known as deinstitutionalization, began in the 1960s, and while it was the correct move for individuals impacted, it was never fully financially supported. This led to a large increase in the number of people with untreated behavioral health disorders living in the community. While the opioid crisis has highlighted the need for more treatment and support services to the public at large, those familiar with the criminal justice and behavioral health systems will tell you that drug use and abuse is not a new problem. We and the mental health. We have seen increased rates of suicide and overdose deaths involving alcohol and drugs other than opioids. According to the U.S. Centers for Disease Control and Prevention, Ohio's suicide rate has increased 36% since 1999. The most recent data on overdose deaths in Ohio shows that deaths involving drugs have increased in nearly every category, except for those due to prescriptions opioids. Data from the Ohio Department of Health shows that deaths involving alcohol, for example, increased 42% in 1 year, from 2015 to 2016. The visibility of the opioid crisis, and its impacts on society as a whole, have offered an opportunity to re-examine the approach we've taken to behavioral health disorders and the criminal justice system. Taking a more holistic approach and beginning to treat behavioral health disorders the same as other diseases will lessen the burden, both in capacity and funding, on the criminal justice system. These needed changes, however, must be paired with healthcare supports, to ensure that people living with a mental illness or a substance use disorder have health coverage and the ability to access treatment services. Our research has shown that there are promising approaches in place all across Ohio and the nation to move in this direction. Ohio has a robust Crisis Intervention Team (CIT) program. These programs help direct people with mental illness into treatment instead of inappropriately sending them into jails or prisons. CIT programs train police officers about how to de-escalate crises, and how to integrate this into their routine practice. Led in part by Ohio judges, mental health and drug courts have been created in an effort to reduce the steady stream of repeat low-level, but nonviolent, offenders that judges see in their courts. These specialized courts allow individuals to receive the support they need, and reduce recidivism, by creating a strict but holistic treatment program that is tailored to an individual's needs. This is just one example of how viewing this issue through a different lens can move us away from putting people living with behavioral health disorders in jails and prisons and toward appropriately connecting them with treatment and services to help them to thrive in their communities. Have something to say about this topic? Use the comments to share your thoughts, and stay informed when readers reply to your comments by using notification settings, in blue, just below. Readers are invited to submit opinion page essays on topics of regional or general interest. Send your 500-word essay for consideration to Ann Norman at annnorman@cleveland.com. Essays must include a brief bio and headshot of the writer. Essays rebutting today's topics are also welcome.